We're now seeing the rise of the Omicron variant in the country, more than 2,000 on the average per day. Why has the booster drive been slow? Is it hesitancy or not just enough information for our kababayans?
Not enough information, and the fact that when the boosters were allowed, it was already at the point of time that we were missing the face of the infection. If you remember, people wanted so much. Everybody was clamoring for a booster dose way back in July and August in preparation for Delta. And when Delta struck us, still there was a refusal to give the first booster dose. At nung pinayagan nga, parang wala na, natapos na. Like, it's a useful thing in vaccination. If the face of the illness is not anymore there, people will tend to forget it. So we have to constantly remind the public. Now, many do not know that with the new variants, having a primary series only will actually mean you are under-vaccinated. And if you are under-vaccinated, you don't have enough protection, and that can still result to death, ICU, and even hospitalization. Not to mention the fact that people are getting confused because they're saying, like, why is it that other countries are starting the second booster?
That's right.
And in the Philippines, we are not allowing it. But at the same time, we're campaigning that, okay, have your first booster. So there are conflicting messages. And one thing about vaccine hesitancy is the trust of the people. So they will start thinking, why is it that it's not being allowed in the other population? They start thinking about vaccine overdose, which actually does not happen, especially if you have an appropriate interval between doses.
You mentioned that other countries have already shown the benefits of two booster doses. Janette, in fact, they've already started giving 2 booster doses to those 50 years old and above. So we're being left behind. And with all of this conflicting information, what must the government do to get us back on track and increase the number of our kababayans who can get boosted from the current 15.7 million?
First, we need to really tell the people an updated definition of a fully vaccinated person against COVID-19. The WHO and the countries with mature regulatory agencies, ang ibig sabihin yan, sila yung mga FDA who really would conduct trials and work on the actual determination of the efficacy of the vaccine and the behavior of the virus, for that matter. The Philippines is not one of the mature regulatory agencies, and we also don't have a WHO accredited laboratory or a regulatory agency. That means we just do table examination of documents. That's why it's very important to really rely on the real experts. Doctors have different capacities. Like an expert in one field cannot be an expert in all fields. So when the Department of Health says we cannot give the second booster yet because we are consulting the experts, they have to be very specific. Because HTAC Council is not the expert on vaccination. It should be the NITAG, the National Immunization Technical Advisory Group. So if we look at the responses of the Department of Health, while I do believe that they have really been exhausted in this fight, it cannot be an excuse that we really have to involve NITAG because they will have access to the global network. NITAG does not only exist in...
In your view, Kong Janette, it doesn't help as well that we still do not have an official Secretary of Health. We just have an OIC. And with a proper plan and strategy to get this done?
It doesn't matter because the OIC has the full powers of a Secretary of Health except for certain specific appointments. And it will be very easy because the current OIC has direct access to the Office of the President. Therefore, if they want to augment human resource, if they want to get advisors, if they want to tap bodies, everything is there. But if we're talking about NITAG and even immunization, that has long been there. In fact, it has been in existence for 31 years. Unfortunately, sometime in, I think, 2012 or 2013, it was dismembered. It came back again as an advisory body and was formalized when the pandemic struck us. In other words, you actually have a body that can advise the Department of Health in terms of policy and vaccination. Because what is happening now is it's like a ping pong. They're telling the FDA to decide to get documents again from the manufacturer that will take months. And they have to go through each document.
So, Kong Janet, will it also help? Because in the past, we would always require a vaccination card to be able to enter some key premises. Will it help if that vaccination card now includes the booster shot to basically put pressure on some of our kababayans to get at least that first booster and second booster?
It will really help a lot. But then again, we go back. Transparency is key to vaccinology and to trust. So the people should know that if you don't have a booster dose, you are under-vaccinated, therefore you are not fully protected. The Omicron subvariant 4 and 5 are spreading like missiles. What does it mean? One person will infect 18 others, and those 18 patients will infect 18 others. Imagine the multiplier effect. Napakabilis niyan. So in this fight, we cannot afford a lockdown. We have to balance health and the economy. And how do you do that? We all have to be protected. And that means we have to boost our soldiers. And why are we saying we need a second booster for the 50 years old and above and those with comorbidities? Because the patients that we are now seeing in the hospitals, many of them are below 60 years old. Almost all of them have comorbidities, either they're asthmatic, diabetic, and we're seeing moderate cases, even if they have a single booster shot. That's why we have enough vaccines. Vaccines are practically expiring. If we are allowing a second booster for the healthcare workers who are like 28, 30 years old, because they are facing a lot of people, why then can't we allow a driver, a waitress, a security guard, economic frontliners, because we cannot afford them to get moderate or symptomatic COVID. It's quite expensive to be sick at this time.
Thank you so much for your insights, Iloilo Representative Janette Garin.